Welcome to Glass Half Full with Leslie Krongold. She shares her stories, experiences, and knowledge of living and coping with a chronic health condition. Learn about tools and resources and hear inspirational interviews that help you to live a life filled with quality and dignity. With 2 decades of support group leadership, Leslie's ready to help you make lemonade out of life's lemons. Are you ready?
Welcome back. Well, that's for me. It's been 3 weeks since my last podcast episode, and I have really missed it. Did you miss it too? I hope so. Hey, this process is good for me, but I hope it's also good for you. I was out of town in the Big Apple, so to speak, attending the Accessible Yoga Conference. What a city. I'm so glad I lived there when I was young and more able-bodied. It's not so much having mobility issues that prove difficult for navigating New York City. There's just so much stimuli. The sights, the sounds, the smells, all the people moving at a fast pace, stairs everywhere, small spaces to move through or live in. Oi, one big oi. Okay, back to the here and now. This is the first of future episodes I hope to explore one's participation in research studies relevant to your health condition. I've participated in several. Most are self-reported surveys that are either mailed to me or I take online. And by self-report, I mean I'm responding to questions about my behaviors, feelings, activities, and no one is observing me. It's how I view myself. This type of research is by far the easiest for most people. You don't have to leave your home. I've also participated in research studies where I did leave my home. Over a period of 4 years, I traveled across the country to Rochester, New York, for 3 separate visits to a hospital clinic where not only did I fill out self-report surveys, but I also had diagnostic procedures and even gave them a piece of me, a piece of my leg muscle, which they said was the size of a pencil eraser. But I digress. I won't talk about the noise the machine made, which captured my leg muscle. I'll save that for another time. I'm going to focus on a different research study that I participated in. Since 2009, I've been involved in an annual self-report survey affiliated with the University of Washington. I've never met anyone affiliated with the research study. It generally takes me less than an hour to complete the survey, and I recall receiving a few newsletters over the years about the progress of the research. Well, this past January, I decided to contact one of the research study coordinators affiliated with the study to see if they were open to an interview. And they were. I spoke with Amanda Smith, the research manager for RRTC. That stands for Rehabilitation Research and Training Center. This is a program funded by the National Institute on Disability, Independent Living, and Rehabilitation Research, and that program is housed at the University of Washington, the state, not D.C. Amanda explained to me that the study I've been participating in for the last 8 years is called Aging and the Quality of Life Survey. It's a longitudinal survey across the United States whose initial goals were to learn more about healthy and successful aging of people with disabilities and what that means, as well as how people experience secondary conditions. Those secondary conditions, secondary to their disability, include pain, fatigue, and depression. Over time, the study has received additional funding, so the researchers have also sought to find out what barriers may exist for accessing health care, and they also explored what role positive psychology has played in how people experience and manage their secondary conditions. The birth of the positive psychology movement is said to have begun in 1998. It is the scientific study of human flourishing and an applied approach to optimal functioning. So positive psychologists examine concepts such as happiness, resilience, as well as other strengths and virtues that enable individuals, communities, and organizations to thrive. So let's pause now and define, or as researchers might say, operationalize the term resilience. Resilience refers to the capacity to recover quickly from difficulties and bounce back into shape. Researchers affiliated with this Aging and the Quality of Life survey at the University of Washington asked people with disabilities to describe resilience, and some of those comments were being buoyant, rolling with or dancing with a disability, taking things one day at a time while also planning for the future, finding a new normal as life changes. And I would say that description most resonates for me because I always feel like I'm acclimating to a new normal. And when I say always, I don't mean always. I have repeated episodes of assessing what a new normal is. Back to the list. Another response to what is resilience: making the best of life with a disability and trusting that stressful times will pass like the weather. But before we go too far into resilience, let me tell you more about this study and how did they find me. Amanda explained that they were most interested in people who were living with a disability that they had acquired earlier in life and had aged with the condition rather than aging into a disability such as osteoarthritis. So it's a notable distinction, don't you think? Aging with a condition, but just regular aging, and because you're aging, you're more inclined to have certain disabilities, such as osteoarthritis. They selected 4 chronic conditions: multiple sclerosis, muscular dystrophy, spinal cord injury, and post-polio. The primary tool the researchers used to find people with muscular dystrophy is a registry at the University of Rochester, and I'm in that registry. So I was interested to know how many people have been involved in the study and how the researchers decided to focus on certain areas such as secondary conditions.
So we had 1,862 participants in our first survey. And today we have 1,518. However, we did recruit some new folks into the survey when we got that new round of funding, because we had initially, folks consented to completing up to 4 surveys. So then we had to reconsent when we got the new grant. So I went ahead and looked, and of the 1,862 who completed the first survey, we have 70% of those folks still participating. So 1,322 of them are still participating in the study.
Is that a good sort
of pretty high
average
retention rate?
Oh, is. Okay, that's great.
Particularly, I think, for a study that we had to reconsent. So we couldn't bug people and say, hey, but you completed, this last one. Are you sure you don't want to keep, we kind of just invite them once, and, if they'd like to continue, then they can. We have about a 90% response rate each time point. So for everyone that we send a survey to, we get about 90% of them back, which is pretty high. And that may be due to our diligent reminder letters and reminder calls that we make.
I wonder if there are differences between different conditions, because in my disease community, myotonic dystrophy, most people that I meet are so eager to participate in some type of research, and especially something that is self-report just, once a year is very accessible.
Yeah, I know that we do get some comments that our surveys are quite lengthy, and I understand that sentiment. The primary reason I would say that we lose folks is because of their passing,
Hmm.
and that's particularly true for our participants with post-polio syndrome, who tend to be older than the other groups of individuals. And then the second reason I would say is just because we lose their contact information, that they've either moved or gotten a new phone number and we're not able to reach them again. Back in 2008, before we even did the first cycle of the survey, or the first survey itself, we ran some focus groups with, folks who were living with these conditions, and we asked them about what healthy aging meant to them, what types of things would be important for us to look at, what should we be asking. And that was one place where we came out of this real focus on secondary conditions, and also about the importance of support. So social support, resilience, ability to participate in valued activities. So that really informed some of the questions that we asked in the subsequent surveys. And then we did another round of focus groups when we got the second cycle. So that would have been between the fourth and fifth survey. And we asked again about this idea of healthy aging. And we also asked about access to healthcare. Are there things that you've encountered in your healthcare experience that were a barrier to you, like a scale at your doctor's office that is a wheelchair accessible, things like that. And then we drafted some access to healthcare questions based on the feedback, and then went back to our participants and asked a few of them to read them over. Are these appropriate? Are we missing anything? Things like that. So we try and incorporate more qualitative pieces to our work when we can. We also have an advisory board that includes folks from our projects.
The research is still ongoing, with the seventh survey currently being processed. The team will spend the next year evaluating the data and hopes their funding agency will sponsor another grant. But there are tangible results and products available to the public. I asked Amanda about these. Researchers are using some of the data, so it's not as if it's been held somewhere and you're just waiting for an end date to start analyzing it. What can you or other researchers glean from some of the work that's been done already?
Sure. Yeah, so I think one of the primary themes that came out of the data from the first few years of the survey was really this focus on middle age. We learned that for folks who were living with a physical disability, they tend to experience these secondary conditions like pain, fatigue, or depression most acutely during middle age. And we found that participants who reported that these secondary conditions created just about as much trouble in their daily lives as the primary physical problems of their disability did. So really this focus on middle age. We published a paper about chronic comorbid medical conditions, so prevalence of things like cancer, diabetes, arthritis. And we learned that our prevalence rates in our survey participants were slightly higher than that of the general population. Not a lot, but slightly higher. And that the age of onset was a little bit younger than the general population. And again, it fell in between that middle age bracket, so between 45 and 64. So this real focus on middle age was a big take home for us. And, a lot of the aging research that is out there is focused on people who are 65 and older. Well, what about middle age? So that was a big takeaway for us.
Well, I've often felt that I could characterize my condition to friends and family who don't really understand it as, imagine I'm 20 years older. And,
yeah,
what would a 70-year-old or plus be going through? And just, the moving slower, all the, as you call them, secondary conditions that are sort of heightened at an age when my peers are not necessarily experiencing them. So
sure. That's a concept that we would call accelerated aging.
Perhaps not such sobering news regarding comorbidities and accelerated aging. Where's the good news, you ask? Remember I started this episode talking about resilience? Well, I saved the best for last. Here Amanda talks about a relationship between resilience and how people with disabilities experience their secondary conditions.
And we were interested in learning how resilience may be related to the ways that people experience their secondary conditions or their ability to manage those secondary conditions as they get older.
I've had a couple podcast episodes where we do talk about resilience, so that's very interesting to have that term come up.
It's interesting to see the research sort of shift from, how do we help people who are experiencing pain or fatigue to sort of this sort of more positive focus on how do we help them build resilience, how do we help them stay engaged in activities that are of value to them.
So I know I sent you a bunch of questions and I will get to all of them, but some just pop up and I'm wondering, what have you learned about resilience, if anything, yet?
Yeah, so we've published a few things about resilience. I know you mentioned one of the charts that was included in a newsletter that we had sent out to our survey participants. And that was done, or that came from an analysis that we did with our survey data from the first year through the fourth year. And we looked at how people reported resilience and also how they reported things that they were experiencing like pain or fatigue, and also their satisfaction with their ability to participate in social activities and their physical functioning. What we found was that resilience seemed to act as sort of a buffer, if you will, in the trajectory of those secondary conditions. So people that reported higher levels of resilience at the first survey reported less of a change in things like pain over time. So those who had lower resilience reported their pain also getting much worse over the 4 years. And those with higher resilience reported less of an increase, if you will.
But we still don't know, is resilience, or maybe we do know, I'm not familiar with the research, but is resilience something that you sort of garner in childhood and it's stored away, or is it something that people in their 40s, 50s, and 60s can build?
That, I think, is up for debate in the literature as a whole. I think that our researchers would argue that it's a little bit of both. Mm-hmm. That some people, start out with a little bit more resilience than others, but that it's certainly something that you can build and strengthen over time. We produce a few different evidence-based fact sheets on different components of aging with disability, and we just published one on resilience and ways that you can build resilience. And so that's available. It's free to download. It's on our website. It's called How to Bounce Back.
Okay.
And all of our fact sheets are written by one of our investigators or postdoctoral fellows and then reviewed by our researchers. And then they go through a set of reviews with consumers, so with folks who participate in our studies who are living with these conditions. We usually do at least 3 rounds of those on each fact sheet to get feedback on, what's useful, what's not, is there anything we left out, what don't you like, things like that. And then we do another round of revisions, and then we publish them. So we're pretty proud of our fact sheets, and I think people have found them to be pretty useful. So certainly take a look. We've got quite a few of them up on our website.
So how do these trickle down into healthcare workers' hands throughout the country?
So we partner with a few different organizations to try and disseminate these as best we can. Certainly we don't have a marketing budget to be able to get these out as widely as we would like, but we do partner with the American Association on Health and Disability, and they promote our fact sheets for us. We've also partnered with the National Council on Aging. Our funding agency helps to promote these for us as well. And then we have, our website and our social media accounts that we use to promote these kinds of products.
More good news. There are organizations and books out there that can help you cultivate resilience. The fact sheet, which Amanda talked about, is linked to the podcast notes on the Glass Half Full website. I've also included links to the Center for Greater Good, a program affiliated with the University of California, Berkeley, with articles and videos about resilience. I invite you to check out these resources to help you build on the reservoir of resilience you already have. I'm definitely working on that for myself. Take care, and thanks again for listening.
Thank you for listening to Glass Half Full. Leslie invites you to leave a rating and review on iTunes. This helps spread the word to others dealing with chronic health issues. For show notes, updates, and more, visit the website glasshalffull.online. Glasshalffull.online.